Dr. Seitlin is responsible for advancing family medicine on the world stage. He introduced the concept of general and family medicine with the World Health Organization, developed and served as Director General of the International Center for Family Medicine, and served as consultant for several international and governmental organizations. He has been president of the Center of Studies of Family Medicine of the University of Western Ontario in London, Ontario since 2005 and holds many international awards and honors. Mesdames et Messieurs, c'est avec grand plaisir that I ask our President, Dr. Sandy Buckman, to bestow honorary membership on Dr. Julio Seitlin.
Bonsoir, Mesdames et Messieurs. I haven't prepared nothing written. I try to follow my heart and only recognize what the Canadians did for us. I think that this award is awarding yourselves, because I will mention only 3 or 4 things that will convince you that this is true. My first advisor when I started family medicine in Latin America was Irma Queenie, and I wrote the first book called in Spanish, ¿Qué es la medicina familiar? What is family medicine? And in have written one of the chapters of in 1982, what is family medicine? The second important project that I want to mention to you is something that happened with the University of McGill in Montreal. Not many people knows about that, but I consider this was one of the most original and powerful projects developed between a developing country and a developed country like Canada. And I will explain you rapidly what happened with that. It was the first time in the history that an academic institution like the University of McGill made an agreement, a partnership with a labor union in Argentina that covered the construction building workers and their families, 1 million people in that time. And this worked about 5 to 6 years in a joint project in which I was the advisor, in which McGill University contributed with many, many important concepts like community-oriented primary care, the use of focus groups in the relationship with the communities, and these kind of things. Then I can't avoid to mention the names of Yvonne Steinert and many other people from McGill that worked 5 years with the labor union of the construction workers in Buenos Aires. This is a big, big project. Also, lately I would like to mention that we had an agreement, and it was mentioned by Carl Gutkin, with the University of Western Ontario, where the Center of Studies of Family Medicine helped us to develop some activities to reinforce the research forces or the research human resources in Buenos Aires. And under their inspiration, we created a sister or brother center in Buenos Aires that takes the name of Irma Queenie, Center for Studies in Family Medicine, Irma Queenie, an Argentine institution. And lastly, I want to mention that I receive regularly Canadian family physicians. And one of the inspiring sections of this is Vital Science, written with so good style, so sense of humor by Carl Guttin that really it provides me many inspiration month to month. And thank you for all. Dear Canadians, be convinced that this award is for you. Thank you very much. Merci.
Gracias, Julio. It's our honor to have you now as part of our College of Family Physicians of Canada. I am pleased to present to you, ladies and gentlemen, Dr. Louis Oppenheimer to receive honorary membership in the College of Family Physicians of Canada. Dr. Oppenheimer. Le Collège des médecins de famille du Canada est très heureux de conférer le titre de membre honneur du Collège à Dr. Oppenheimer. Dr. Louis Oppenheimer is being presented with honorary membership in recognition of his outstanding leadership and work related to one of the most pressing problems facing the people of Canada today, namely timely access to care. Dr. Oppenheimer's work regarding waitlist initiatives, engaging family physicians and other specialists in a collaborative approach to improve the referral consultation process in Manitoba have opened the door to resolving this significant challenge not only in Manitoba, but hopefully across our entire nation. Le Dr. Oppenheimer a été directeur de l'unité de soins intensifs et chirurgie de l'Université du Manitoba et directeur de la recherche du Health Science Center et de la Health Science Center Foundation. He has served as head of the Department of Surgery at the University of Manitoba and medical director of the surgery program for the Winnipeg Regional Health Authority, and was appointed provincial director of patient access and clinical system improvement. As assistant dean, innovation and system design and quality, faculty of medicine at the University of Manitoba, he was instrumental in launching the George and Fay Yee Center for Healthcare Innovation. Dr. Oppenheimer is presently the medical director, Manitoba Telehealth, and professor in the departments of surgery and family medicine. Ladies and gentlemen, I welcome our past president, Dr. Robert Boulay, to present honorary membership in the College of Family Physicians of Canada to Dr. Louis Oppenheimer.
Bonsoir, merci à tous, congratulations. I am very grateful for this recognition and this honorary award, and I take it, as the previous speaker, not as a measure of a personal work, but measure of work done together with family physician colleagues, surgeons, and even Department of Health supporters in Manitoba. And let me tell you a little bit about our work. We were charged with rationalizing waiting lists and quickly discovered that this was really not a matter of resources, which is the good news. In 20, sometimes 50% of the waiting list we examined, and in the process of doing that, and I'm reminded of the stories, we talked to over 5,000 patients who were waiting, or thought they were waiting, or thought they were being counted. And what we discovered is in many cases this has nothing to do with resources, with communicate, but it's only a matter of communication. And that they were in the wrong waiting list for the wrong procedure, or at the same time that there were many specialists who felt entitled to prescribe what hoops you'd have to go through to be able to refer a patient. And we felt this is just not on. We just can't continue to have this. And here came the idea of having a forum and have all the parties at the table. And I know that that caused initially some trepidation, and I remember our past president, Dr. Credenster, writing me a very pointed letter about what I needed to look for, and I guess I did okay, sir. and at this forum, what we learned that was very important is we needed to allocate enough time to what I would call letting the evil humors out on both sides of the discussion. Because only after the evil humors have been let out, can you heal? And after that, invariably, we'd have groups of champion family physicians, specialists who work together and developed joint, not imposed, but joint referral paths. In fact, they were more than referral paths, they were agreements, because what we determined is that in exchange for the time that it would take what we had mutually agreed to do, there were guaranteed consultation times and guaranteed dates, which is what patients really want to know. There's the time to wait for the appointment, but there is the time and the wait to know when. And what's very important for peace of mind is to know when. And so now we have a system that is web-based. It's now hopefully going to be EMR interoperable, and it is a work in progress. We have an evaluation process which tells us that it is a work in progress, but what it is universally accepted is that the process of having brought people to the table and engaging into dialogue and collegiality was something that everybody, whether they use the pathways or not, found very, very rewarding. And so I'm very grateful to be now a member of the college, and I hope that now that I'm a member of your college or our college, I can report further progress in the future. And thank you very much, and congratulations to all of you.
Thank you, Louis, and thank you for leading this very important work. The College of Family Physicians of Canada on September 21st presented a major document. It was presented on Parliament Hill in the House of Commons, and it is called, and you will hopefully hear more about it, but it's the Vision for the Future of Family Practice in Canada, called the Patient's Medical Home. And there are many components to it, but one of them is, and it's critical to it, is addressing what we certainly understand is a major concern for the population of this country, and that's timely access to care. And a piece of that, without a doubt, is the journey for the patient through the healthcare system, with a focus on that journey from the family physician to more highly specialized care, including our other specialist colleagues. And we know there's a major logjam there, and we want to address that. We want to take a leadership role in it, and we are really, really grateful for the work that Dr. Louis Oppenheimer and others are doing to help us to look at this in an appropriate manner. So thank you, Dr. Oppenheimer. Mesdames et Messieurs, it is an honor for the College of Family Physicians of Canada to bestow honorary membership to the late Dr. Deanna Midmer. Mr. Robert Midmer, Deanna's husband, will be receiving this award. Robert, could you please come forward? Le Collège des médecins de famille du Canada est très heureux de conférer le titre de membre honoraire du Collège à Dr. Midmer. Deanna Midmer achieved her BSc in nursing from the University of Western Ontario in 1968 and her master's and doctorate in education from the University of Toronto. C'est à titre posthume que nous lui conférons la désignation de membre honoraire et reconnaissance de sa contribution à la médecine familiale comme chercheuse et éducatrice à l'hôpital Mount Sinai et au département de médecine familiale et communautaire de l'Université de Toronto, et que nous reconnaissons son leadership et son rôle de directrice de la recherche nationale, de même que ses nombreuses réalisations sur le plan pédagogique. Deanna is being posthumously presented with this honorary membership in recognition of her contributions to family medicine as a researcher and educator through her work at Mount Sinai Hospital in Toronto and the Department of Family and Community Medicine at the University of Toronto, and in recognition of her leadership and director role of several national research and educational initiatives. Deanna founded and directed many research and educational projects, including the Antenatal Psychosocial Health Assessment, ALPHA project, a screening instrument to determine a pregnant woman's risk for partner violence, alcohol abuse, postpartum depression, and other adverse psychosocial outcomes. She was a founder and co-principal investigator for Project CREATE and CREATE Canada, looking at improving addiction education for medical students, residents, faculty, and community physicians. Deanna also helped establish pregnancy-related issues in the management of addictions, a program called PRIMA, a multidisciplinary organization dedicated to improving care for pregnant women who abuse substances. Deanna served as